Hello Reddy, how are you?
I'm good, beta. क्या हाल है?
I'm fine. So today we got this question from Manu Chaja 4892. So this person's question is that, so today my query is that how to prevent embolic events on CPB.
How to prevent embolic events on CPB? Manok Jhaja, we can make this question in two parts actually. First is prevention prior to the embolism, air embolism in the circuit, and second is if the event happened and how to treat, how to deal. I'm talking the part and the role of the perfusionist in case of you get a event of air embolism in the circuit, or as per your question is how to prevent air embolic events on CPP. So first we'll talk about the safety measurements, how we can prevent the air embolism in our circuits. So first of all, in our extracorporeal circuit, we have a level sensor which we placed on the reservoirs, and from the cardioterminal reservoirs is going to help us to maintain the level of the volume in the reservoirs in case your volume is decreasing and you're losing the volume. So the machine will going to alarm you that and there is a soft alarm of the flow is compromising, and secondly there is intervention where the machine stopped. So one safety measure is like you have the level sensor. Number two, you have a bubble detector, so you always place the bubble detector after the carotome reservoir. So your second defensive safety measure is like bubble detectors. If you the bubble sensor, if they sense a huge bubble in the circuit, the machine will automatically go into intervention mode. So machine will stop, so we can intervene the situation of air embolism. Okay. Number third is your oxygenators, and in an oxygenator you have the filters, and the filters, the bubbles with the less amount can be detected and stuck in the membrane, so where you can remove the this bubble in the air through the recirc line by informing to your surgeon, informing to your cardiac anesthetist, and clamp your venous line, clamp your arterial line, and open your recirc line, and just run your pump for 1 to 2 liter and try to tap it and remove the air which is present in the circuit. So this is the safety pre air embolism safety measurements which you have to take as a perfusionist. But in case of there is a air in pass through your circuit into the patient, then this is something other how to deal it. So first of all, once you feel that and this happened with you, that air enter in your patients through the circuit, inform to the surgeon, inform to the anesthetist, stop your circulation of pump, clamp your recirc line, clamp your arterial line, decrease temperature, inform to anesthetist to start ventilator from their side. And for the role of anesthetist is he will going to change the position of the table. Instead of the supine, you can take it in the reverse Trendelenburg positions. I mean, head will be down and the legs will be up, and he will going to press the carotid. The surgeons will going to remove the arterial cannula from the aorta, and he will fill the cavity with the water, and then he going to connect your arterial cannula in the SVC, and you can run the pump for 1 to 2 liters through retrograde flow for a couple of minutes. So make sure that you are able to remove the air and debris from the circulation, and decrease temperature as much you can decrease the temperature, and then after make sure that the air is removed from your the body, just come back with the supine position, cannulated in the aorta, and return back the bypass in a routine fashion methods. So this is the things we can do during there is a event happen as a micro embolism or air embolism in the circuit. And as I mentioned in the beginning, first of all, you have the safety checks, you have the safety measurements, you have the safety devices available on extracorporeal circuit, like you have the level sensor, you have a bubble detector, you have the filters which are going to help to detect and keep the your air away from the patients, and then you have the option how to remove theirs by clamping your venous line, by clamping your arterial line, by opening your arterial recirc line, and you can remove the bubbles through from your membranes. Secondly, some of the oxygenates, like I have the membrane oxygenator, you have the purge lines, so which we always recommended to keep it open throughout the surgery. So in case of any air pass through from the reservoir into the air into the membrane, so micro bubbles can be removed through the your death purge line. In the scenarios of the pediatric surgeries and most of the centers, but I'm not sure presently what you people are doing, but the circuit prior to prime, you can flush your circuit with the CO2. So you, as you know, CO2 is heavier than the air. So when your circuit is prior to prime, you retrogradely fill your CO2 into the priming circuit, and once you remove all the air from the circuit, you can prime, add the crystallite, and you will find that your circuit is free from the air, and you will get a better outcome of their priming of your circuit free from the air. So this is the different strategy you can apply for to keep your circuit free from the air. So in case, so the first, you have a pre-safety checklist, and in a pre-safety checklist, this is a pre-event, so pre to air embolism, you have the safety checks where you have the level sensor, you have the bevel detectors, you have the physically eyes on your levels to keep the level above than 400 ml in adults, and keep the 100 200 and above volume in your reservoir. Always keep your hand on your knob so you can intervene in case of any lose of the volume. And always the best thing in a situation where you need in a critical and crisis situations, you have to very good communication between your team, like in a surgeon, anesthetist, and your action with the corrective measurements you have to perform, and deal with the scenarios like air in the circuit. This is in a cardiopulmonary bypass. If you talk about extracorporeal air in the circuits, here the scenario is much different. In an extracorporeal membrane oxygenator, you have to clamp your return line. Instead of the venous line, you have to clamp your return line and keep your access line open, so that you can use the pre-membrane pigtail and just take the air from the membrane, like maybe 50 cc syringe with a lever lock, and take 2 or 3 times, and you know the air is lighter, and you can remove all air from the membrane, and you can decrease your RPM to 0, inform the team members, and start your ventilation from ventilator side, and inform to the group. And I'm talking about now the with the ECMO scenarios, even the air events of the air embolism, air in the circuit. So then remove and make sure that air is you are free from the air, and don't clamp your excess line, because if you're going to clamp the excess line, there is a chance that you are making a more air in the circuit, because you not have a volume to take it back the from the air from the membrane. So keep your access line open, keep your arterial line clamp, and then take a fix the syringe on the primary pre-membrane and remove air. And once you make sure the air is free, then start your RPM like 1000 RPM and slowly open your clamp, and keep the hydrophobic port open, so that if there is any micro air, that can be removed through the membranes automatically. So this is the way how to prevent from the air embolism events. As a perfusionist, I try my best to explain as much I can, and as you know, this forum is open for everyone, and you can give your input in this my talk. And I love to hear from you guys your experiences, because this channel is totally based on your experience based, and we talk about our experience, what we are dealing during our clinical trials. And Judge Manuk Jaja, hope you get your answer. And my dear friends, my colleagues, if you like this video, please share with your friends, like it, comments it, and I'm ready to answer your questions. And I'm very lucky that I'm trying to enhance knowledge myself and even yours. So this is the sharing knowledge group. Have a nice and good day. Bye bye.